guys, and welcome back to another episode of Hey Dr. J, where we cover pharmacy basics one topic at a time. I did want to say thank you for all the interactions so far. It's been incredible. I haven't really seen questions in the comments yet, but I am getting a lot of questions in person, which is fine. It's great because it is what I love to do, and it does deal with the intentions that I have for this channel. I gotta treat y'all like my retail patients where I love you, but you don't listen, and it's fine. It's fine. It's fine. I guess I did end up talking with my sister about it, about how people may be embarrassed to ask questions, or they do have topics they'd like to see, but they don't necessarily want to be associated with those topics, which is fine. That's fair, because in retail, you do have a consultation area, which is typically to the side. So even though it's public, you have some privacy. So after much consideration, I have created a question form where you can ask your questions there as well if you are uncomfortable asking them in the comments. I do require emails to make sure that I am talking with people, but having your username included in the question when I make the response video, that is optional, and you'll see that on the form. So the question that I received in person was, how do you know when your body needs potassium and how can you get it? Good question. And today we'll talk about what happens when you have too little or too much potassium in your body. So the big word is called hypo or hyperkalemia, with hypo being below normal or not having enough, and hyper being excessive or having too much potassium in the body. Kalemia is kind of like a Greek/Latin word for potassium. Word terminology, we'll get into that later. When you're experiencing low or hypokalemia, you kind of feel tired, weak, your muscles can cramp or spasm. You can have numbness in the limbs or arrhythmias, which is like an irregular heartbeat. You can also feel excessively thirsty, like no matter how much you drink, it's just not going away. Diagnosis with hypokalemia can be tricky because most of the time it is a mild or a slow onset, which means it's a gradual thing that you notice and not something that just happens immediately. So if you do experience these symptoms, you typically would drink water and something with electrolytes in it, like Gatorade, Powerade, or Pedialyte, and then you kind of monitor. If it goes away, great. You can also add foods that are high in potassium, like cantaloupe, bananas, of course, potatoes, spinach, peanut butter, beans, and lentils. Potassium is tracked through blood draws in labs, so if you are still experiencing symptoms even after monitoring for yourself, you may need to get lab work done so we can kind of see where your labs are actually falling. Biggest reason for this is hyperkalemia has very similar symptoms, but is a lot more dangerous. You can still experience those muscle weaknesses and the numbness in your limbs, but abdominal pain or belly pain, nausea, diarrhea, and chest pain tends to happen more with hyper than hypo, and in these regards, you do need to seek medical attention. The onset tends to be quick and sudden and can be life-threatening. Why? Because too much potassium in your body can stop your heart. Prime example of this happening is potassium chloride is used in lethal injections in prisons. It's one of the drugs in the cocktail that they use there, and it is used to stop the heart. So if you are diagnosed with hyperkalemia, you tend to avoid foods that we've mentioned before, and they'll put you on a medication like a diuretic to pull more of that potassium out of your body. And in urgent situations, you'll have like a potassium binding drug. These drugs are disgusting in taste and they smell terrible. You can get it in a retail setting, but it can be expensive depending on if your insurance will cover it or not. If you are diagnosed with hyperkalemia, you also want to avoid salt substitutes, because even though they're low in sodium, they tend to be high in potassium as a replacement. So if you already have too much in your body, you really don't need these substitutes. So that's it for this one. As usual, post your questions or feedback in the comments below, or you can use the question form that is now available on the home page. And until next time, stay safe, y'all.